Welcome to Nursing School.
Welcome to Nursing School.
Vital sign. Blood pressure. Blood pressure is the measurement of pressure pulsations exerted against the blood vessel walls during systole and diastole. The cardiovascular system is a closed system, and the measure of blood pressure determines the pressure of blood inside the system. It is measured in terms of millimeters of mercury, mmHg, standard. But this can be converted to centimeters, cmHg. The blood pressure gives two measures respondent to the cardiac contraction. The maximum, maxima, indicates the measure of the systolic pressure, and the minimum, minima, indicates the measure of diastolic pressure. The variation of those two measures is the indication of assessment of cardiac activities and resistance offered by peripheral vessels. 1. The systolic blood pressure. Systolic pressure is the pressure exercised by the blood flow on the arterial wall at the time of the systole. That means that when the left ventricle of the heart contracts, throws blood in the circulation, the arteries are then to their maximum of tension. 2. The diastolic blood pressure. It is the pressure exercised by blood on the arteries during the diastole. That means that at the time of the relaxation of the ventricle, this minimum pressure is constant on the level of the arteries. 3. Pulse pressure. This is the numeric difference between the systolic and diastolic pressure. Pulse pressure has an importance in health assessment to the diagnosis and to the prognosis. This pressure represents the volume of blood thrown in the circulation during the systole. 4. 5 factors exist to maintain the normal blood pressure. 1. The pumping action of the heart, cardiac output. Cardiac output is the volume of blood pumped into the arteries by the heart. When the pumping action of the heart is weak, less blood is pumped into arteries, and the blood pressure decreases. When the heart's pumping action is strong and the volume of blood pumped into the circulation increases, the blood pressure increase. 2. The peripheral resistance. If the caliber, lumen, of the peripheral vessels is abnormally small, the blood pressure increases. Inversely, if the caliber is very large, the blood pressure decreases. 3. The quantity of blood. When the quantity of blood decreases, for example in case of hemorrhage, the blood pressure is decrease. If it increases, blood transfusions, the blood pressure rises. 4. The viscosity or consistency of the blood. More blood is viscous, more the blood pressure will be raised. The greater the viscosity, the harder the heart must work to pump blood, with a resultant increase in blood pressure. 5. The elasticity of vessels. The vessels with a reduced elasticity offer more resistance to the blood passage. Therefore, if the resistance increases, the blood pressure will be increased. Physiological factors that influence the blood pressure. The common factors are age. 2. Exercise. 3. Stress. 4. Sex. V. Disease process. 6. Position. 7. Medications. 8. Position. 9. Obesity. Sites where to take blood pressure. The blood pressure is usually taken on the arm using the bronchial artery unless there is some damage to the arm. If it is impossible to take BP on arms, for example because of cast, burn, lesions or various traumatism, the BP will be taken on thigh, but it is necessary to have a long sphygmomanometer to suit the thigh. Wrap the blood pressure cuff on the arm 1 inch above client's brachial pulsation, with bladder centered over brachial artery. Equipment needed when you are going to take blood pressure. Sphygmomanometer. BP cuff, BP machine, stethoscope, patient file, pen. Mean arterial pressure represents the average pressure during the cardiac cycle. Mean arterial pressure is systolic pressure and add 2 multiply by diastolic pressure over 3. Mean arterial pressure represents average arterial pressure during cardiac cycle. Has to be approximated because period of diastole is longer than period of systole. The systolic pressure varies between 90 and 140 mmHg for an adult. For the diastolic pressure, it is between 60 and 90 mmHg for an adult. Average of normal values of BP are 1 newborn, 70/40 mmHg. 2 infants, 90/50 mmHg. 3 adult, 120/60 mmHg. Pathological variations of blood pressure. It is necessary to distinguish the following pathological variations: hypotension, hypertension. The variations of the differential tension hypotension, low blood pressure, when the maximum or systolic blood pressure is below 90 mm Hg. Hypertension, high blood pressure, when the systolic blood pressure or maxima is more than 140 mm Hg and that the diastolic pressure or minima is more than 90 mm Hg. Management hypotension. Put the patient in Trendelenburg. Alert the physician when you are at the hospital. Give physiological solution drip of preference or ringer lactate. Continue observation. Treat cause. Refer to the hospital. Management hypertension. Put the patient in supine position. Assure calmness around him and to reassure maximum relaxation. Refer to the hospital center if you are in health center or seek for medical advice. Give diuretic if the high blood pressure is very important. Continue observation. Treat cause. Give glucose solution drip.